Hey guys, how are you? This is Jim from the Pain PT, and today's topic is going to be it's harmless. It's harmless, guys. It's harmless. If you have a diagnosis of TMS, meaning that you've ruled out structural issues in your body, there's not a structural pathological cause, or the doctors can't find anything wrong, or your finding is just a normal abnormality, then what you're experiencing is harmless. And I'm going to explain why. And Dr. Sarno said the same thing, and that's why people really got better, because they moved from believing and thinking something was very harmful, something was really bad, what was going on, they can't figure it out, to nothing's going bad, it's harmless. It's TMS. Okay, so why do I say it's harmless? Well, because if it's not structural, it's stress-related symptoms. If it's not structural symptoms, it's stress-induced symptoms. The most classic case of this is somebody going to the hospital who having chest pain and terrible heart palpitations and arm pain, and they're so worried about a heart attack, and they get all the testing done, and the doctor says, you're not having a heart attack, you're having an anxiety attack, a panic attack. What does he tell the person? You're fine. You're okay. There's nothing wrong with your heart. Go home, relax, work with your anxiety. Off you go. Okay. This is the same thing. Okay. The anxiety in that particular case, which is an emotion of strong fear, caused those symptoms in the body. So the reason why it's not dangerous and it's harmless is because it's emotion in your body. It's stress. Stress is emotion. Okay. It's the same thing. So we know the stress can cause all sorts of symptoms in your body in different ways. And we're thinking of it that way, and we know it's that, which is TMS, then we need to think it's harmless. It's not dangerous. It's not bad. And when we can think that way, it completely changes our approach to how we deal with it, right? How we move forward. And it plays off my last video, which said you're just trying to teach your brain you're fine. You're not trying to fix something you think is wrong. And this is the same idea. If it's harmless, there's nothing to fix. The only thing you're doing is teaching the brain to turn off that danger stress signal. Okay, and the danger stress signal may be turned on because of current stress, past stress, even going back, adverse childhood events, personality traits, way you do things, self-imposed pressures, on and on and on. End of the day, all that stuff, all of it, harmless to you. It feels very bad. It can hurt terribly, but it's not harmful. We have a saying in physiotherapy that says, it can hurt, but it doesn't mean you're harming anything. It can hurt bad, but it doesn't mean you're harming anything. And this applies here. So if we take the idea and truth and premise that what you're feeling is harmless, it's stress signaling, meaning again, your nervous system's intact, your brain is intact, your muscles and ligaments and fascia, blood vessels are all working okay. They're intact. The architecture's fine. It's just what's flowing through the system is stress. And that flow creates the symptom. But if you thought it was harmless and you treated it as a harmless condition, a harmless symptom, what would you do? That's my question for you guys today. What would you do if you knew it was harmless? Would you treat it? Would you try to fix it? Would you try to stop it? Would you put a lot of attention on it and focus on it? Would you avoid doing things, going places, stopping? I don't think you would you? I wouldn't if I knew it was harmless. So this idea, guys, is the core foundation that if you get a diagnosis of TMS, there's nothing wrong with the symptom. It's just a stress symptom, which means it's harmless, which means you need to get back to everything normally and teach the brain there's no danger. Teach the brain that emotions aren't dangerous. Okay, again, these are emotions, which is stress in your body. Emotions aren't dangerous, are they? Are emotions harmful? No, all emotions are okay. They're harmless. So what we just need to do is to recognize that in us and start our approach, start our treatment, start our foundation of moving forward from this idea and concept and belief and truth that what you're experiencing, your pain, your particular symptom is harmless. I really want you to walk away from this video and come back to it as much as you need and come from that premise every day, because it should change completely the way you do things. Again, it's just like going to the doctor for something and he examines you and you're super worried about it and super concerned about it. And he says, look, I don't see anything wrong, or you don't need stitches, or it's not a tumor, it was just something else. And all of a sudden, usually what happens is people go, oh, thank God, relax. And in some cases, people will continue to have symptoms for a while afterward, while the symptoms recede. But what typically happens is the person walks away going, I'm fine. And I still have pain, I feel it, but I'm not worried about it anymore. I'm just going to carry on, and eventually it just kind of fades down. All right, that's what can happen. Okay, so in this case, that can happen for you too. And in other cases, we need to do some more deeper work around emotions, because that's what drives the symptoms. And so we have to dive into emotions more, because they basically control and produce everything. Emotions produce thoughts. Emotions produce behaviors you do. Emotions produce symptoms. So they're a driving force behind a lot of things. And a lot of people are not in touch with their emotions in a good enough way, and so it comes out in their body. Like Sarno said, repressed emotions or suppressed. But they're not harmful. Emotions are harmless, guys. Again, they can hurt terribly. I've seen it personally with a number of patients going to the emergency room, sent to the hospital with stress-induced symptoms. I've seen it a number of times. So I know it can happen. It can cause very severe, very real symptoms in your body. But at the end of the day, they walk out of there and the doctor says, we don't see anything wrong. We can't find anything. There's nothing we can put our finger on. Okay? So guys, foundation, harmless. Harmless. Again, the question to you, what would you do right now and tomorrow and the next day if I told you what you're experiencing is harmless in yourself? How would you operate differently? And I want you to take that from today's video and come back to it as much as you need to refresh that, because the brain a lot of times will go back to its pattern of, I don't know, is it harmless? That's the doubt and the worry, which is the anxiety, creeps in again. Okay? So we don't want that, because that's just going to add more stress, which causes the symptoms in the first place. Okay, guys. Hopefully you take this foundational video today, it's harmless, and apply it to your condition. Again, get it ruled out. I always say that. I'm not saying everything's TMS, so get it ruled out, but pretty much everything I treat is TMS, because everybody's been assessed and looked at. But not everything is stress related. There are structure related issues, but a lot of chronic stuff, the majority of chronic stuff, is stress related, not structurally related. Okay guys, I'm done for today. I'll see you next time. Bye-bye.